Hi, it's me, the MA mentor. I am back again for part two of our integumentary system. Let's go ahead and just jump right in. So here is part two of the integumentary system. Basically, we'll be discussing aging and the various pathophysiology or diseases and conditions that come along with this system. Here we go again. Always, if you have not already, please like and subscribe to my channel so I can continue to bring wonderful content to you, hopefully, and help you out along your journey to becoming an MA or possibly even just, updating some of your knowledge if you are already an MA. Okay, so aging and the skin and the hair and the nails. Um, Here's what happens when we age. Our collagen, our elastic fibers, what I had discussed that are, contained within the dermis of our skin, start to break down a little bit. And of course, this is, during our younger years, is what keeps our skin nice and elastic, able to stretch, able to stretch back after, it's been stretched out. Um, but as we age, unfortunately, those start to break down and not work quite as well as they used to. So we do see some sagging of the skin, some wrinkles, okay? We also have a decrease in the adipose tissue or the subcutaneous layer, which makes us then also a little more sensitive to cold, just sensitive to a lot of things because we don't have that extra padding or insulation that we once had. Our skin starts to dry out a little bit, because more so than it used to, because of a decrease in the production of sebum or oil. And then, of course, we start to decrease in melanin production as well. And even though this doesn't necessarily affect our skin as much because our skin is our skin and it's going to be the shade that it is at that point, it does start to affect the hair because melanin is responsible for our hair color as well. And so this is where we start to see gray hair. And fun fact, gray hair, although some people have different shades, right? So some people have very white hair, some people have more of a silver, what they call salt and pepper, right? What you're seeing there is not that it's changing the color per se. Basically, what's happening is because of the absence of melanin, what is creating that gray color is air bubbles. Air bubbles have been replaced where the melanin once was, and that's why you end up with that kind of gray or silver looking hair color. So I always joke that as we get older, we become more airheads. All right, let's talk about disorders of the skin. So disorders of the skin, we do have infectious disorders. We also have non-infectious disorders. We'll start with the infectious disorders, being acne, athlete's foot, cold sores, and impetigo. We will take these one at a time. We'll start with acne. Acne is a chronic skin disorder. Oftentimes we see this start to be more apparent in our teen years, because our bodies are changing, puberty hits, oil production starts to ramp up a little bit, and we will see those pores and even sometimes hair follicles, excuse me, that start to become plugged and they form pustules. Sometimes then also those pustules, because they're plugged up and they're not, you know, draining necessarily properly as they normally would and coming out to the surface of the skin, then the bacteria can build up and you can get, a partial bacterial infection as well, which that's what acne is. It's basically a perfect storm of clogged pores with sebum and bacteria building up, and that's what causes a pimple. Okay. Um, some people are more apt to this than others, and some people will experience this throughout their whole life, versus those people that struggle with it in their teen years or maybe into their 20s, but then as they get older, don't have as big of an issue with it. And from the pictures you see right here, these are more probably severe cases of acne. Um, depending on your age right now, you probably remember when you were, a teenager, unless you still are, and, you would have pimples, especially in what they call the T zone. So your forehead, your nose, your chin, right? Sometimes on the cheeks, but this is more of a severe case. And maybe you'd have one or two now and again. Maybe you'd have a lot, but acne is a real thing. It usually is not a big deal when a patient finally decides to go and have it treated, is if it is severe enough. Moving on to athlete's foot, or what we call tinea pedis. Athlete's foot is contagious. It is a fungal infection, so it is created by fungus. Can lead to red, flaky, and itchy skin, obviously on the feet, in between the toes, under the toes. Here are some just pictures of what it can look like. Varying degrees of severity, obviously, but can be remedied with antifungal creams and medications, even systemic medications that a patient would take orally. However, it does take a very long time to deal with athlete's foot, and it's very tedious process because you have to keep the feet clean and dry because fungus loves moist places, and wear our feet most of the time inside socks and shoes where they start to sweat. So sometimes it can be a real battle to deal with athlete's foot, especially if you are prone to it. Cold sores or fever blisters. These are fluid-filled blister-like sores that end up on and around the mouth. Excuse me. They are produced by herpes simplex 1, which is a virus. They occur on the lips and the oral membrane. Oftentimes, just because of the nature of the herpes simplex viruses, they tend to be brought on by stress. If somebody's very stressed out, they will tend to get a fever blister or a cold sore more so than they would normally. These can be, of course, treated with antiviral. There's creams. There's like not chapsticks, but Abreva is a brand. I'm not at all sponsoring them or anything like that. But that's one of the kinds that you can get over the counter. Impetigo is highly contagious. It is a bacterial infection that creates fluid-filled pustules um, that end up rupturing and will leave behind this like yellow crust. Typically affects children. However, it is very contagious. So if somebody deals with children a lot, like in a daycare situation, or even as a parent, is around their children a lot, they can actually wind up contracting this as well. But for the most part, is a childhood contagion, so to speak. All right, moving on to non-infectious skin disorders. We have things like alopecia, bed sores, burns, eczema, hives, moles, and psoriasis. Those are the ones we will address. Keep in mind too, these are not exhaustive lists. There are a lot more of these, but these are kind of the main ones to look out for and that you would see if you were working, say, in a dermatologist's office. So alopecia is literally just a loss of hair. It is more common in males than in females. And these are some more, what I've got on the screen here are probably more severe cases of it. But it can cause very patchy looking hair. Sometimes, a lot of times it'll affect the part, make the part a little wider. It again, levels of severity can have little tiny patches, big giant patches, the whole head. Really just depends on the person. Bed sores, or what we call decubitus ulcers. This is a chronic deficiency of blood flow to the dermis and the subcutaneous layers. Um, this occurs over bone, usually due to pressure, prolonged pressure, and is very common in bedridden patients. So you'll see this quite often in, say, nursing homes, anywhere where a patient is in bed a lot, is in laying down a lot. Um, which is why it is so important to, if the patient is not able to move a lot, to roll the patients over every so often, just so this prolonged pressure on these areas does not occur. And you see this primarily in the buttocks region, the heels, the hips sometimes, um, primarily because those are where the most pressure is and is closest to the bones. Um, Again, the level of severity is different. It varies. You can have, just a little beginning of a sore here all the way to this big giant open ulcer. Um, Very painful, very uncomfortable. So it's very important that these patients are watched and monitored for these types of things. Burns can occur for several different reasons. A burn is literally just damage to the skin, but it can be because of heat or fire, right? Chemical burns, radiation burns. There's several different things that can cause burning from the sun. There are degrees of burns. So a first degree burn is when the epidermis is just involved, and that's your typical like sunburn, okay? Which you see right here. Okay, it really only involves that top layer of skin. A second degree burn is more of epidermal involvement, but also partial dermal involvement as well. So it actually goes down to that second layer. And in a second degree burn, you can actually even see blistering occurring, um, but is fairly treatable. It's fairly treatable, and not horribly damaging. Third degree burns, however, are what we refer to as full thickness burns. Those go all the way down through all of the layers, and will oftentimes, this is a third degree burn up here, this is second degree. This third degree burn also will sometimes involve what they call charring, where it's actual like, it looks like charcoal of the skin where it actually turns black. That type of burn is severe enough that it can cause other issues to the underlying structures. Um, Usually, in order to treat it, it takes a lot of time, sometimes even skin grafts, where they have to take skin from another part of the body, or donor skin to fix that. So that is a really serious type of burn. Eczema, or what they call atopic dermatitis, is generally due to irritants or like allergic type reactions. Some people are prone to it, some people are not. It causes inflammation, redness, itchiness, scaling, cracking of the skin. Can occur pretty much anywhere on the body. A lot of people do get it on their like their hands and their arms and the backs of their legs and stuff like that, backs of their knees. But it can occur anywhere. And there's really nothing, as far as risk factor. It really just depends on the person's skin and how sensitive they are to certain things and certain irritants. Hives are red, itchy bumps or welts that appear on the skin, can appear pretty much anywhere. And it's usually an allergic reaction, but can also be, if people are prone to them, be brought on by stress. You see people that, highly stressful situations, or just are very sensitive to anxiety, can produce welts. Otherwise, it's generally an allergic reaction. The common mole, or what we call a nevus, can be a pink, tan, or brown growth on the body. Oftentimes, these will start to appear when a person is younger and then just kind of grow a little bit throughout their life. Most are not concerning. Um, of course, as most, well, pretty much all dermatologists will tell you, if you notice a mole that is changing shape or color or something like that, it is best to have it checked out just in case, because there are some instances where a common mole can turn into a cancerous lesion. So it's again just best to kind of keep an eye on them if you notice them, and if they start to change a lot, get it checked out. Better be safe than sorry. Um, but what a normal nevus, or just your common mole, really is caused by is just a cluster of melanocytes that kind of just cluster up. Um, you'll notice, so like you see this really dark mole here, even that one's pretty dark, and this one's not so much dark. Um, Chances are the dark moles are going to be on people that are normally darker skinned anyway, because again, their melanocytes are creating more melanin. More melanin means darker skin, if you watch my previous video. Um, and some of the lighter pinky or tan ones might be on the people that are less likely to have darker skin. So, all right. And then lastly, we have psoriasis. Psoriasis is chronic dermatitis. It results in red, raised patches of very scaly skin. Can be anywhere on the body. Most commonly, though, occurs in the scalp, the knees, the elbows, the buttocks. But it basically just is a result of excessive skin cell production, and usually is triggered by stress more commonly than not. Some people just tend to have it all the time. Again, levels of severity. I've seen, people that have psoriasis just in little tiny patches around that you can barely notice. And then some people have the big, what they call plaque psoriasis that, like this patient right here that just has the giant patches of it. Um, Either way, there are treatments for it, creams, ointments, things like that. Um, but unfortunately it's chronic, so it's something that someone generally lives with for, pretty much their entire life. All righty, so we are just going to go ahead and stop there. Thank you so much for joining me for this. Please do keep an eye out. Again, this is going to be an anatomy and physiology series, so I will be doing the additional body systems as we go along, and I really look forward to seeing you on that journey. Have a great day, and we'll see you next time.